know that cardiovascular disease, mainly coronary heart disease and stroke, remains one of the leading causes of morbidity and mortality worldwide. Further, secondary prevention among people with a history of CVD is important because recurrent events are common. On the other hand, there is a lot of evidence supporting the beneficial role of physical activity in the primary prevention of CVD death, but the impact of physical activity on long-term CVD mortality has not been widely studied in people with pre-existing CVD. For this reason, we think that it's relevant to know how the level of physical activity is associated with cause-specific CVD mortality among people with a history of CVD, and to determine if this association is similar to that found in people free of CVD. Hi, my name is Verónica Cabanas-Sánchez, Assistant Professor at the Universidad Autónoma de Madrid in Madrid, Spain, and it is my pleasure to summarize our article entitled Physical Activity and Cause-Specific Cardiovascular Mortality Among People with and Without Cardiovascular Disease, a cohort study of 0.6 million US adults, published in Mayo Clinic Proceedings in the April 2024 issue. For this work, we combined data from 22 waves of the United States National Health Interview Survey, so that the analytical sample was made up of more than 500,000 people free of CVD, over 78,000 people with coronary heart disease, and nearly 19,000 people with stroke. Physical activity was reported by participants, and the leading underlying cause of death was determined based on probabilistic matches of participant records to the National Death Index. Thus, we explored in detail the association of physical activity with specific CVD mortality in people with CVD. In example, we analyzed the relationship between physical activity and disease of heart mortality in people with coronary heart disease, and the relationship between physical activity with cerebrovascular mortality in people with a history of stroke. Moreover, for comparative purposes, we also analyzed the association of physical activity with CVD-related mortality in people without CVD, as well as the relationship between physical activity and non-CVD mortality in all subpopulations. Firstly, we noted an inverse, nonlinear, dose-responsive relationship between physical activity as a continuous variable and cause-specific CVD mortality in all subpopulations, but with some difference in the shape of the association curves. Curiously, we observed that the survival benefit for people with CVD was greater than for those without CVD at all physical activity levels, and that the dose-response relationship outspread to high levels of physical activity in people with CVD, mainly in participants with a stroke. Moreover, we also estimated hazard ratios for the association between cause-specific CVD mortality and physical activity, but categorized according to the recommendations. That is, no physical activity, less than recommended physical activity between 150 and 300 minutes per week, and more than recommended. And we found that in people with coronary heart disease, compared with no physical activity, doing physical activity was associated with reductions in the risk of heart disease mortality between 26 and 42%, while among people with a stroke, recommended an additional amounts of physical activity were related to around 30 and 60 lower cerebrovascular mortality, respectively. We also observed that physical activity exerted a greater protection on cause-specific CVD mortality than on mortality from other causes in people with CVD. These overall results have clinical relevance because our supplementary analysis showed that in people with CVD, the risk of mortality due to the specific cause of their disease is higher than the risk of death due to other causes, suggesting that the negative evolution of their condition represents the greatest mortality risk for this population. This could be somewhat obvious, but taken together with our main result, it allows us to conclude that physical activity is associated with significant decreases in the risk of the most likely mortality in this population. Moreover, if we consider that the beneficial effect of physical activity against CVD death was greater among people with the persistent disease than in those free of CVD, we can say that physical activity could be even more relevant for secondary prevention of CVD than for primary prevention. So we think that the healthcare professionals should emphasize the importance of a physically active lifestyle for patients with CVD, and effective strategies to increase physical activity in people with CVD should be found and implemented if no contraindications exist. And that's all. Thank you very much for viewing the summary video, and we hope that you all enjoy reading the full article in Mayo Clinic Proceedings. All the best.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.